Hi everyone, Dr. Shook here. I hope you're doing well today. Today what I want to talk to you about is a very important topic, and that is Alzheimer's disease. Now you may not be aware of this, but a lot of research has been ongoing with Alzheimer's disease, and there are some researchers that have been thinking outside of the box. Traditionally, the way that Alzheimer's has been approached was to, or has been, and it does continue to some extent, continue to focus on the beta amyloid plaques, the changes that you see on the brain when you look at imaging, and trying to remove those to see if that will improve cognitive function. But there have been some researchers that have been looking at this problem of Alzheimer's, because what's happened is that we've seen over 240 drugs that have been gone through trials, and billions of dollars have been spent to try and improve Alzheimer's, and they've all failed. They've all failed. You've got to understand that they've all failed. 2 medications have been approved to support Alzheimer's, and they don't address the cause. They address the symptoms. They actually don't do anything to stop the pathophysiological process that's contributing to Alzheimer's. So this is a major issue. So some of the researchers that have been looking at this from an alternative perspective have been considering the biochemical changes in the body and looking at those changes to see if they could determine the factors that are promoting these changes within the brain. Now, what they've been looking at is this protein, or this molecular switch on the nerve cell called the APP, amyloid precursor protein. And what they've been doing is they've been investigating what trips or flips this switch in a negative way that causes a lot of the negative changes associated with Alzheimer's. And they've identified 36 different factors so far. They think that we're going to be somewhere between 50 to 100, 36 driving factors and 6 subtypes, okay? So what we're talking about today is we're talking about subtype. Really, it's the second subtype. There's subtype 1, and there's subtype 1.5, then there's subtype 2. So we're talking about subtype 1.5 Alzheimer's disease, glycotoxic or blood sugar related. This is a huge issue. Now this, I became familiar with the subtypes, the 6 subtypes that we currently have. I became familiar with those over the past, year and a half, 2 years. But for the last 5 years, maybe even longer, I've been aware of what researchers call type 3 diabetes. Okay, type 3 diabetes. You ever heard that before? Type 3 diabetes? They are saying that type 3 diabetes is Alzheimer's disease. So if you look at the scientific literature, you'll see that throughout the literature, if you go to pubmed.gov and you just type in type 3 diabetes, you'll see that researchers are calling it Alzheimer's disease, or Alzheimer's disease type 3 diabetes, because they call it diabetes of the brain. And now the reason for that is because when you have blood sugar fluctuations, when blood sugar's high, right, when blood sugar's up, blood sugar's high, when insulin is high, insulin's inflammatory, blood sugar, it creates these very negative things called advanced glycation end products. All you need to know is that these spikes in blood sugar and insulin do some very negative things to our brain, to our circulatory system. I mean, if you're diabetic, or if you know someone that's diabetic, you know this all too well. The end stages of diabetes are not a pretty thing. We see we see nerve damage in the form of peripheral neuropathy. We see kidney failure. We see blindness. We see amputations. And it's all due to these negative effects that damage microcirculation, the tiny vessels that supply our tissues with blood and nutrients and oxygen. And when they start to collapse and die, we end up having some very negative changes. Now, this directly affects the brain. This affects the amyloid precursor protein and flips that molecular switch in a way that creates a lot of negative changes and promotes the factors that we see contribute to Alzheimer's and cognitive decline. So, knowing that, what can we do? We can be aware of this as a risk factor, we can identify it in people, and we can use tools that we know can reverse that process. We can, listen, type 2 diabetes, when I work with people, I've been working with people with type 2 diabetes, with thyroid dysfunction, with autoimmunity for over 10 years. I've been doing it because I've suffered with autoimmune thyroid problem, psoriasis, irritable bowel syndrome, all kinds of my own issues for about 15 years. So I had to figure out how to help myself, okay? I've been working with people with type 2 diabetes, thyroid problems, hormonal problems, gut dysfunction, brain fog, and quite frankly, a lot of these people have the risk factors that contribute to Alzheimer's. Been doing it for about 10 years. You know, when I work with people that have type 2 diabetes, which is, you know, really more than half of my clients, we see people, when they follow our instructions, we see people reverse that all the time. All the time. And I'm going to explain to you a few of the factors that contribute to it and what we have to do to reverse the blood sugar related issues. So identify the risk factors, which we've identified one of those here. Identify the things that are contributing to you having the risk factor. We'll talk about those in a second. Once you identify those, you reverse engineer the process and you help the person to correct the risk factor so that it doesn't continue to promote the changes of the brain that contribute to cognitive decline and Alzheimer's. Okay? It's just simply it's a simple process. I'll explain to you the exact steps that we take. But this is what we have to do to help people that are sick. We have to truly look at the factors that are keeping them from being healthy, and we have to address those using diet, supplementation, lifestyle factors. No medication can fix these problems. I'm going to tell you right now, there's no free lunch with the body. You can't take a pill, force chemistry onto the body, and expect it to be healthy. Because you're just treating a symptom. You've got to address the underlying causes. So, okay, the things that have to be considered when you're looking at blood sugar, because so many people suffer with blood sugar problems, with type 2 diabetes. I mean, it is a massive, massive problem. And this is what they're all told. You need to diet and you need to exercise. You need to eat whole grains, which for a lot of people can be the very worst thing that they can do. And you need to exercise more. And most people, when they exercise, first of all, a lot of them can't exercise because they hurt or they have no energy. Or when they do exercise, it actually is detrimental because it does something I'm going to explain to you down here. It promotes a stress response and actually contributes to higher blood sugar. So there's an order that you have to do things in. So diet and exercise, we all know these, but the reality is there are some missing pieces that I see all the time, completely overlooked with diabetics, that have to be addressed. And when I explain this to you, a light bulb is going to go off and you're going to know the truth. And then you're going to say, you know what? Why isn't this explained to me? Why haven't I been told this before? How is it that we can continue down this path of just taking more and more medications, following dietary and exercise guidelines that are impossible and even outdated, and I'm just getting the same approach that everyone else that has type 2 diabetes gets? There's bio-individuality, guys. You are unique and you're different than someone else. And the factors that promote blood sugar related issues with you is different than someone else. I'm getting ready to show you why. So diet and exercise is what everyone's told. However, did you know that one of the biggest factors that I see in people that have diabetes that is missed is the first of the three is inflammation, okay? And I'm not talking about some kind of abstract inflammation. I'm talking about a high HSCRP, high sensitivity C-reactive protein that you can measure in a lab, that we measure on people every single day. But you know what? Insurance doesn't cover that if you're looking at it for preventative measures. They will look at it if you have a stroke or a heart attack, because it's a risk factor for stroke and heart attack. Guess what else it does though? When your inflammatory load's high, you have decreased sensitivity. To, guess what? Insulin. Insulin lowers blood sugar. High inflammation, decreased sensitivity to insulin means your insulin builds up and you have insulin resistance. Now, how does that help your blood sugar? It doesn't. It actually drives the blood sugar higher and creates a lot of problems for you. Now, guess what? This is a hormone, right? Guess what else? You also have decreased sensitivity to other hormones that will affect your blood sugar and your metabolism and prevent you from reversing this process. So you have to look at inflammation. The next thing that you have to look at is, this is very commonly missed, guys, cortisol. Cortisol is your stress hormone. Guess what cortisol does? Your body uses cortisol to adapt to stress, okay? To adapt to stress. What it does is your body uses cortisol to adapt to stress. So let's see, where can we put this here? What it does, there are 3 stressors. Okay, 3 stressors. There is inflammation. I'll explain these to you. 2, there's emotional stress. And there is physical pain. Okay, so your body will use cortisol to respond to these. So if you have high inflammation, your body will increase cortisol because cortisol is anti-inflammatory. But guess what cortisol also does? Cortisol also is diabetogenic, meaning it causes diabetes. It contributes to diabetes because cortisol also, when cortisol is high, you raise blood sugar. You know how this works? Have you ever had low blood sugar before? Your blood sugar ever been low? You get shaky, clammy, sweaty, you can even become nauseous. That's your body, your brain is activating your adrenal glands to produce cortisol. Now, why did it do that? It did that because cortisol, when cortisol comes up, when blood sugar is low, the brain will recruit the adrenal glands to make cortisol and adrenaline. That's why you shake when you get low blood sugar. When cortisol comes up, it stimulates a process in the body called gluconeogenesis. You have stored blood sugar that's not in the bloodstream. It's in the muscle and it's in the liver. So you break that down, you break that sugar down in a process called glycogenolysis. You break down glycogen, which is stored blood sugar. It dumps into the bloodstream, and now you have increased and higher blood sugar because you've liberated or freed stored blood sugar, put it into the bloodstream so the brain can continue to run the body. Cortisol being high raises blood sugar. I just explained to you how that happens. So guess what? If you have an inflammatory process that's ongoing, you're going to have higher cortisol. You're going to have higher blood sugar because the body's making cortisol to deal with the inflammation because it's also anti-inflammatory. Do you see the cycle here? So then your blood sugar's higher, your insulin's higher, and you're making these advanced glycation end products, and you have all of these negative consequences of diabetes, and you're tripping the APP protein promoting cognitive decline and Alzheimer's. It is all connected. It's why ignoring these things is ridiculous. Once you are exposed to this, you know it's true because it just makes sense. It's how the body works. Okay, cortisol. So emotional stress and physical pain, how do those drive up cortisol? Well, so you have this wonderful part of your immune system called the autonomic nervous system. Emotional stress, physical pain drives a stress response. It's an involuntary response controlled by the autonomic nervous system. You have 2 sides of that autonomic nervous system. One of them you're very familiar with. It's called the fight or flight response, and it's the sympathetic nervous system. When you're under emotional stress or physical pain, you activate and increase a sympathetic nervous system response. What does that mean? It means that you make all these hormones associated with stress. Cortisol goes up. And then everything we just talked about, that cascade of problems continues, okay? Physical pain, the way that your body deals with physical pain, you will activate the sympathetic nervous system, you'll produce all these hormones, cortisol goes up, all these negative factors occur, okay? All right, is it making a little bit more sense now? So blood sugar is not as simple as diet and exercise. It's not. Okay, the 5th thing. So remember I said here, when you have high levels of inflammation, you decrease your sensitivity to insulin. Remember that? Well, what happens here is that your other hormones, you lose sensitivity to other hormones as well, like thyroid, okay? Now, why is thyroid an issue? Because thyroid sets the metabolic rate of the cell. If you can't burn sugar for energy, then sugar is going to build up in the bloodstream. And when sugar builds up in the bloodstream, you have high insulin, you have all this negative process that's occurring. So do you understand, can you see why this is so important and how a lot of the things that we're doing are purely symptomatic and they're not going to help people get their health back unless we look at really getting people healthy, unless we acknowledge the fact that there's a lot more to Alzheimer's, to blood sugar problems, to diabetes than just diet and exercise or taking a medication. It is not addressing the cause of the problem. So what can you do? Well, you can do trial and error. If you need assistance, I work with people all around the world, across the country. We do work with people helping them to investigate the problems that are promoting their cognitive issues, their cognitive decline, their health. You can go to new.alzconsult.com and you can learn more about working with me. If you want to try some things on your own, I've got some ideas for you, some things that you want to consider. So number one, there's 3 things you can do. You can try keto, okay? So most of the brain researchers today will tell you that they think if we were going to choose a diet, that the ketogenic diet, which causes your metabolism to switch from sugar burning to fat burning, is probably one of the best things that we can do for the brain. So it decreases inflammation, and it's more favorable and appears to be the ideal diet for people that have cognitive issues. I love a ketogenic diet, but ketogenic diet is one of the things you can consider. You can look into it. There's some healthy ways to do it, and there's some very unhealthy ways to do it. We help people to do it a very healthy way. Then you can try IF, or intermittent fasting. Now in particular, this is where you it's time restricted eating. You can do an 8-3 or a 12-3. So you eat 8 hours of the day and you don't eat 3 hours before bed, or you eat 12 hours of the day and you don't eat 3 hours before bed. This has also been shown to be very, very helpful at improving metabolic issues and improving insulin sensitivity. So intermittent fasting is something to look into. Number 3, you can support vitamin and mineral status. Now, vitamin and mineral deficiencies contribute significantly to poor neuron health and function. So vitamins and minerals are going to be critical to have proper vitamin and mineral status. So a good multivitamin, a good fish oil with high EPA is beneficial. It depends on the case, but EPA, DHA, just a good fish oil. Vitamin D, vitamin A, K, all of these things are fat-soluble vitamins. Making sure you have adequate magnesium, zinc, these are critical. So these things are things that you can look into, that you can try on your own. But if you want some assistance at trying to look at these factors that are contributing to cognitive decline, or if you want to prevent cognitive decline, that's where we're really doing a lot of work with people. If they're just worried about cognitive decline, if they are noticing that they're not quite as mentally sharp as they were, if they have a family history of Alzheimer's, or just want to be as mentally sharp as possible, then what we do is we will help you to look at the factors that we would look at in someone that has cognitive decline or Alzheimer's, and we can see what's happening to you. Are you shifting? Is any of your biochemistry, or do you have a need to address some of these problems that have not yet, progressed to a point where you actually have measurable mild cognitive impairment or Alzheimer's disease, right? So we can help with prevention. We can do what we call a cognoscopy. Instead of like a colonoscopy when people hit 50, we can do a cognoscopy to look at your cognitive function and help you, look at what's going on biochemically, put together a plan for you, get you on that right path before it becomes a bigger issue. So if you want assistance with that, we work with people all around the world, across the United States. Just go to new.alzconsult.com. You can learn all about our Saving the Brain program and how we work with people around the world. But I appreciate you guys hanging out with me today. I hope this has been helpful. Look forward to talking to you soon. Thanks.